tell what's on the docket today. We've got back injury prevention to go over. This is one of those topics that we train on that's not necessarily life-changing. It's not necessarily anything that's going to harm you for years and years and years to come, but it's one of those things that we always need to just remind you of and give you some of those safety tips on. That's why we kind of work it in every single year. How many of you woke up either this morning or yesterday morning with back pain or neck pain, a neck ache? For some of us, that's every single day, I'm betting. Has anybody ever been through a back surgery? Good to see, because even with a group this small, there's usually somebody in the room that's gone through a back surgery. So anybody that's had that back tweak or that stiff neck, you know how that changes your day-to-day activity. It might not be something that's really, horribly traumatic, but it's something that's going to impact how you do your day-to-day life. And again, those are the reasons why we go ahead and do the training that we do on an annual basis. There's a couple of different elements that we're going to look at today. We start with some statistics. I don't go too crazy about those, but I'll have you help me with some of the questions that I brought with you today to kind of get through those stats. We talked a little bit about stretching. We had a good laugh about some of the companies that are implementing that kind of thing today and seeing injury rates going down because of it. Proper lifting techniques. You guys have learned how to lift a long time ago. We're going to talk about why we're still getting hurt even though we know all of those techniques. And how to prevent your injuries, whether you're at work or at home. What can we do to keep you safe to make sure that doesn't happen to you? And I'm going to start with a video.
You need to lift something. Let's say that something is about a third of your body weight or less, up to 51 pounds. Moving it properly is easy. Simply bend at the knees, grab that something, and lift using your leg muscles. Oops, keep it close to your body. There you go. Nicely done. Upright back, close to your body, use your legs, all excellent rules of thumb. But there are other factors to consider. These include the awkwardness of the lift, the height you'll be lifting, the distance you move the object, the frequency or repetition of the lift. In each of these cases, you should figure that you'll be able to safely lift less weight and consider other options. For example, let's say you have to lift more weight or lift it through a greater distance. You should not attempt the lift by yourself. Ouch! Instead, use a hand truck like this, or flag down a coworker like this. Good work. Or what if the lift is to the left or right of you? Even if it's barely light in weight, twisting your spine during a lift can hurt your back. So turn toward the object nice and square. Very good. Then lift straight up. Now pivot your entire body and move the object. You're getting good at this. Here are a few more things to remember when preparing to lift. Organize storage to promote safe lifting by keeping heavy, awkward items in the power zone between shoulder and knee height. Stretch before lifting to get your muscles ready. Ensure you have solid footing and are wearing non-slip shoes. Plan your route to avoid tripping. Test the weight to be sure you can handle it alone. By lifting properly, you avoid pulling a muscle, straining your neck, or rupturing a disc in your back, which means you stay on the job, earning your full pay. Lifting right feels good, doesn't it?
All of these old techniques that they just went through, you guys have heard all those before, right? Was anything new in this video for you?
Not bending the legs. I didn't see that.
Was that not in there?
Yeah, it wasn't.
We'll talk about that one as we go. But some of these old standbys that you've learned from a long time ago, you guys know how to lift. Why are we still getting hurt? Do you have sprains and strains on the OSHA 300 lock from time to time?
Yeah. Oh, yeah.
Why does that happen? We know how to do this. Are you guys practicing these techniques every single time you go to lift something or move something?
Of course.
I don't. I thank you for your honesty. Because usually people will give me the eye roll and go, no, we're kind of busy. So to stop and really analyze this thing from A to B, it's going to take a little bit of time. I think Steve will look at your time and go, what the heck are you doing out there? We do need to slow down a little bit. You've said a couple of times today, pay attention. There's a few areas where we can do that along our way and make sure that you get to keep your good, strong core for a few years. Help me with some of these questions that I brought for you today. How much do you suppose Americans spend on back pain every year? What's the magic number?
50.
Usually people are like, go big. Go big or go home. In this case, it is 50 billion. If any of you have been injured at work, or Brooke, you've seen how some of the workers' comp stuff comes in, they linger. These injuries, hurt, you go to the clinic and you're done, you never go back again. These types of injuries drag on and on, it might be 6 months, it might be a year. So you can see how this gets to 50 billion. But if you've ever had to go to the chiropractor or a physical therapist on your own, out of your own pocket, you see how this adds up to 50 billion in a quick hurry. I've had to contribute to that number in the past. The most common cause of back sprains, strains, and injuries are what? Car accidents, lifting, working out, or bad posture?
Bad posture.
What else?
Lifting.
Lifting. These two fight for me. For our purposes at work and thinking about where some of our injuries come from here, lifting, but bad posture has to come right behind that, because if you would just go about your day with bad posture, or even in your time off when you're sitting at your table eating in bad posture, that weakens all of your core muscles, and now all of a sudden it's gonna be time to have a back injury. So for this question, it is lifting, but bad posture is right behind it. Studies have shown that stress can increase minor back pain, true or false?
Real true.
Very true. When you get tense or rigid and you're stressed, you can feel the hardness in your muscles sometimes. If you are tasked with lifting or moving some kind of equipment out in your area, that's when you're gonna see the back strain sneak in, because your muscles are so tense and tight. Women, where do we carry most of our stress? Any idea? Can you feel it some days? Sometimes it just feels rock hard. How about you guys? Where do you carry a lot of your stress or your back pain? Low back. Any idea why that is? We'll go through that. There's a video coming up that'll show you that. In this case, this was true. How about this one? Using a back belt helps you lift heavier loads without injury. True or false?
False.
Very false. Have any of you ever worn a back belt? Whether it's at work or at home? You put that on, you cinch it up. It feels pretty good, doesn't it? When you put that on and tighten it up. If you've never worn one, if you've got a little bit of a back pain or a tweak, you put that back brace on and it tightens up, and you're gonna feel it. It's gonna feel better. So what people do is put one of those on at the beginning of their shift and then come to work, and as good of employees as we are, we go back out to our workspace and we work it, and we're, balls to the wall with our shift. What's gonna happen when you go home and take that thing off?
Back spasm.
You're gonna feel it. You're gonna know that you overworked. Somebody said it perfectly this morning, a false sense of security. So if you know that anybody's wearing those, if you ever hear that, you guys in the office, gals, let's talk about what's happening there so that we don't cause further injury. I gave it away. Ways to lift a load more safely and efficiently include what? Mechanical aids, adjusting height, reducing weight of the object, or all of the above. In this case, it is all of the above, but now think about what are mechanical aids that you guys have access to? What can you use? Forklift is number one probably here. What else do you guys have?
Got hand trucks.
You got some of those. Do you have pallet jacks here?
Yep.
One at least. Do you have dolly carts? For some of us in here, do you have rolling carts? Anything that's gonna help you move that product. Curtis sat next to me this morning and the group said, Curtis is my mechanical aid. That's not a joke. Ask for help. Get a buddy, get a partner. If it's supposed to be a two-person lift, make it a two-person lift. I had a company yesterday that I was at training, and they said, you know what, when we come into January, you gotta sit down and help us look at our ergonomic issues. We need you to come in here and do a whole full-blown assessment because we have so many injuries on our log. In the next hour, I went out to do my audit, and I see they're a door and window company, and I see one employee trying to move a 12-foot by 12-foot patio door. I don't even need to come in here and spend time doing an assessment. You know what the problem is. Get help. Ask for help. A lot of times we get ourselves in trouble with these lifting issues because either we're independent. I don't need help. I don't need to ask for help. I'm going to do it myself. You're trying to be company wise and maybe not taking two people to do a job, but don't do that. Ask for help if you need help. The adjusting the height of the lifting surface, that was most of what our training focused on last year. Really what I want you to think about there is if you're the guy or gal that needs to squat all day long to do your job, if the work is down in a file drawer or down on the floor, that's gonna get you at some point. That's gonna be bad on knees, hips, shoulders, all of that. So we talk about trying to get that work raised, at least put it on a platform or on a table, so that you're working within your power zone. And the power zone is all of this, because you've got all those big, strong muscles. So if you're the one that's crouching and doing work on the ground or bending constantly, we need to kind of take a look at your workspace and see what we can do to help you. And reducing the weight of an object, always. If you can break the weight down, that's your best case scenario. I won't bore you to death with the rest of my statistics. You guys can read all of those, but I want you to think about that last one. 1 in 3 people say that a back injury impacts your day-to-day life. Would you agree with that? You know it. Anytime I've had some kind of a strain, it just makes everything else a little bit more miserable. If you've got things to do day to day, if you are somebody who works out or exercises, that's gonna change the way that you do things there. Just your day-to-day routine can be changed drastically just because of a back sprain or a strain, so please keep that in mind. You only have one back, take care of it. So the importance of stretching, you had already mentioned that you've been Mortensen, large giant company. There's a few companies like that that I know of that now have taken in kind of the whole wellness, and they'll start their shifts just like that with a stretching routine. I'm glad that you brought that up, because the story that I usually tell, I've got 2 larger clients up in Fargo that looked at their OSHA 300 log a couple of years ago and said, that's the majority of what's bringing this down is all of the back injuries. What are we doing? Well, they first just started with, let's just stretch for 5 minutes in the morning when everybody comes in and see where that takes us. They've done that over every shift, and over the last 2 years, they've cut their back injuries by at least 50 to 75%, so it's no joke. But when I say that, and I talk to my different companies, they're like, well, I'm not, it's like safety in numbers. You're not gonna stand out there and stretch all by yourself probably, because we don't wanna look like dorks. I'm not the only one that's gonna do it. So what I've heard is when whole companies put this whole thing into their plan, everybody then does it, and nobody has to feel bad doing it. So if there's any way, I know that we're not gonna start a whole stretching regimen here at Pope Douglas, but if there's any way that before your shift, even if before you get here, stretch out your arms, get your shoulders going. Just, what that does is just heat up your muscles. It gives you a little bit of joint fluid and make sure that you're not gonna hear those snaps, crackles, and pops all day long. Okay, I brought you some choices of exercise. I know the first 1 through 6 would be easy to do, whether you're at work or at home, just to stretch out those biceps and those shoulders. But this is where I ask, I don't know, Bill or Harlan, do you wanna come up and demonstrate like number 13 or number 10?
You wanna see him stand for a while?
This is where they picked on Curtis, and they're like, Curtis will do it, he'll come up there and do that. The point with this is I know some of these are easy enough to do at work, others, I'm not even gonna do that. There's no way, I'll do it at home when nobody's watching, sure enough, but the point is, if you can just add a little bit to your morning, some of us have to stretch a little bit before we get out of bed. So if that's your case, if that's your workout, let it be. See if this starts. This is the speaker. That's where your Adobe pants are coming in handy, by the way, for your Christmas gift.
What I'm about to show you about your back will surprise you. Did you know that your lower back works just like a hinge? It's this area right about here, and it's the part of your spine that acts as a pivot point when you lift something the wrong way. The amount of force you place on your back during lifting can be enormous. It's why so many people get back injuries and develop bad backs over time. Here's the surprising part. Your back is like a seesaw, but not a normal one. A normal seesaw has the pivot point in the center. With this kind of seesaw, it only takes 10 pounds of pressure to lift a 10-pound object. Your back is like a seesaw, except that the pivot point has been shifted to one side. And when you shift the pivot point to one side, it takes much more force to lift the same object. The area around your waist acts like the pivot point or hinge, but because the pivot point has been shifted, it requires a 10-to-1 pressure ratio. This means that if you are lifting a 10-pound object, it puts 100 pounds of pressure on your lower back. Now, add in 105 pounds of the average human upper torso, and if this is how you lift, all bent over with your legs straight, lifting a 10-pound object actually puts 1,150 pounds of pressure on your lower back. No wonder people get bad backs. So save your back and stop using the hinge. Lift like these guys do because they take safety to the limit. Take a balanced stance, feet shoulder width apart like a shortstop. Squat down to lift and get as close to the load as you can. Get a secure grip, hug the load, tighten your abdominal muscles and take a deep breath. Lift gradually using your legs, keeping your elbows in to hold the load close to you, and keep your back and neck straight.
That video is all over the place for volume, so I usually try to watch it for you guys. So again, with the old standby tips that we've learned for a while, but that's where I was going to explain to you why we end up with back sprain usually in our low backs, just because our pivot point is off a little bit. last year I remember going through something like this, and one of the hokey terms that I used was, first of all, if you can't go about remembering all of those tips that we keep going over that you learned a long time ago, because there's so many of them, if you can't remember all of those, if you remember this one thing, this is the hokey term that I used last year, resist the twist. If you're trying to move product or move equipment, as long as you can keep your core straight, you're gonna notice that you're gonna have less injury. This is what we do as human beings. Let's pretend that this is my load that I'm gonna move in my box, it's heavy. So I pick it up, I plan my route maybe, but I pick this up and then I stand there for a minute and go, which way should I go? Which direction am I heading? I'm gonna look, I'm gonna turn, and then move my feet last. You see what I did? That's where we get into trouble. As soon as you add that twisting motion, you're gonna notice the back strains and sprains a lot quicker. We laughed a little bit in the last class. I've sprained my back lifting pillows to put them back on my bed. Are pillows heavy?
No.
So it's sometimes not even about the weight of the object, but because I was bending and twisting in an awkward motion, you gotta think about that. Somebody told a story earlier about a UPS worker, or somebody seeing just a small box in their area, they thought it was gonna be harmless, and they bend over to pick up this box and there's 10 pounds of bolts in there. Think about what you're doing and really test the load before you get ready to move it, and I think you're gonna be able to keep your back straight for a
Have you ever
longer
got to the
period of
point
time.
where you like collapse and you're like biting into the carpet?
I mean, just to
Spazzing,
be able
you
to,
can't
oh
get up.
yeah, I mean, how
Yeah.
many of you have been there tying your shoe? I mean, and I'm not old, I don't know
You're
about
like
some of
that.
you, it's not even an age thing, Randy, so. We had a sales guy that worked from home. I was thinking about where this line is, because when you have a workplace injury, you're gonna take care of your employees. So I had a sales guy who worked from home, he bent over to tie his shoe, and he tweaked his back. And he was in physical therapy and on our list for about 6 months, a year. I'm like, dude, you tied your shoe and you were working at home. At what point is that not work related? So be careful with that. A couple of other ideas that I'm gonna give you for preventing injuries. Do any of you work out or like to jog or run or any of that kind of stuff? I don't. Usually in the group we have one of those. Some people do, some people get your exercise while you're at work. If you can keep your physical condition in check, you're gonna notice that your whole body feels more stronger. You're gonna be able to keep all of those strains and sprains to a limit. How many times have we gone to the doctor and they said, dude, you put on some cookie weight over Christmas, you need to take off a few pounds? Nobody likes to hear that, but we know that a lot of times when we accumulate weight, it's right in here, and if we try to, think about what your core weighs. If you're bending over to pick up a load already that's 100 pounds, you saw from the video, this weighs anywhere from 100 to 175 pounds and more sometimes. You're adding that into your lift, you can see why we get back sprains and strains. You said good posture. You guys have to maintain your posture. Stand up straight. It's not just something that Grandma or Aunt Bessie used to harp on you about. Keep that good posture because it keeps your core strong. And I know this one doesn't even apply to you guys because when you walk into the doors of Hope Douglas, all your stress just fades, doesn't it? We've talked about that before. If you can figure out a way to reduce stress, you let me know. But we already said if you guys have stress, whether it's holiday stress or at home stress or work stress, your muscles are already tight and rigid. We gotta figure out a way to get past that and make sure that we keep our back health in check. How many of you love nap time? Anybody with me on that? Maybe not today, maybe not during my safety meetings, but when it gets gray and cloudy, I love nap time. The reason that I want you to think about that is, do you think that your sleeping positions or the amount of time that we spend sleeping is gonna affect how your back and neck feel the next day? Completely. I have a very comfortable pillow top mattress at home. I've got great pillows, but I find that when I stay out and about, I came down last night and stayed in a hotel, that'll jack me up the next day. It just depends on what you're used to and how comfortable you get. If you have the sleeping position where you like the side or on your back, it's not just for pregnant ladies. If you ever feel like you want to try this out and put the pillow between your knees, what that does is take pressure off your low back. As soon as you do that, when you're laying in bed, you're gonna feel it's just kind of a relief in your low back. How many stomach sleepers do we have in here? Anybody love that position? Some people swear by it. If you're a stomach sleeper, there is no other way. Be careful when you're a stomach sleeper. I know that sometimes we get very comfortable with that, but you're throwing a little bit of kind of an extra curvature in your low back, and you're gonna notice that the next annual shift. So please take those things under consideration. Again, if there's any takeaways from this, if there's any possible way that you can work 5 minutes of just a quick stretching before your shift, I think it's gonna help you. Think about those proper lift techniques. Like I said, I'm with you. I learned a long time ago how to lift, but we're busy. We don't always think about that when we're kind of pushed for time. And think about ways that you can prevent injuries so that you don't have a back strain that's gonna linger on for days and months. I like to feel good. I don't have time to be hurt, and I know you guys are in the same boat, so take care of your back. We only have one. Did you all get the sign-in sheet? Did it make it to everybody? Any questions about your back injury plan? This is a lot on us as employees. If it's meant to be a two-person job, get 2 people, don't strain yourself. You don't come to work to get hurt. I know they pay you very well here, but they don't pay you enough to get hurt. So keep that in mind. If there's no questions, that's all I have for you. You guys, Merry Christmas and have a great holiday. You have been awesome as always.